Hi, I'm Dr. Razali Omar, a consultant cardiac electrophysiologist. Atrial fibrillation or AF is a very common arrhythmia. It usually is more common as we grow older. It is a condition where the upper chamber of the heart, called the atria, beats very fast, between 400 to 600 beats per minute. As such, the heart rate the patient will feel untreated will be more than 100 beats per minute. It is not only fast, but it is irregularly irregular. This can lead to a few things. Number one, it can lead to stroke. Number two, it can lead to heart failure. And number three, it can lead to poor quality of life. The incidence of atrial fibrillation in Malaysia is estimated to be about 1 to 1.5%. And in the world, it is estimated, and this was published 10 years ago, that at the moment there are 30 million people, 30, with atrial fibrillation, and the number is expected to exponentially increase. And this is not only in Malaysia, but all over the world. There are many reasons for it. It is not for this video for me to elaborate, but some of the reasonings are that patients are now older, living older life, with higher chance of atrial fibrillation. There are more patients with hypertension, diabetes, and heart failure, obesity, alcoholism, and also the new indication is sleep apnea syndrome. Now, what can happen if atrial fibrillation is if left untreated? The most scariest complication is stroke. The stroke from atrial fibrillation is not the same as stroke from other causes. Stroke from atrial fibrillation is more serious. It can lead to 20% chance of death. It can lead to patients not going back to their physical and functional ability for the rest of their life. So when we see a patient with atrial fibrillation, the most important thing that we do first is to risk stratify those at risk for stroke, such as if you are above 65 years old, if you have hypertension, diabetes, and so on and so forth. Once we've established that there is a high risk for stroke, we will advise you to take a blood thinner. This is called direct oral anticoagulants, for which there are 4 in the market at the moment in Malaysia. Once we've started you on an anticoagulant and to try and reduce the risk for stroke, we will then explain to you how can we offer the treatment for the arrhythmia itself. We can either give you medication called anti-arrhythmic agents. This does not cure the problem, it just controls the problem. The efficacy of anti-arrhythmic agent is only about 55 to 60%. That means up to 40 to 45% of patients will not respond to medication. The best treatment for patients with atrial fibrillation right now is to undergo a procedure called catheter ablation of atrial fibrillation. For the last 20 years, we have been using energy source called radio frequency and cryoballoon. These two are the same, in which it delivers thermal heat, either in the form of heat, radio frequency, or freezing. They are both thermal and therefore transfer of energy. This leads to a possible risk of collateral damage, which is very scary for us because it can damage the phrenic nerve and the esophagus. For the last 1 year, Malaysia has introduced or has approved the use of pulse field ablation. So what is the advantage of pulse field ablation or PFA? Remember I said there was this collateral damage from radio frequency and cryoballoon. This is addressed by PFA. Why? Because PFA is delivering electrical current and not thermal. It is tissue specific, meaning that the PFA is designed to only affect the cells of the heart muscles, either the atrium or the ventricle. If you were to shine this onto the cells which is in the esophagus, the phrenic nerve, it does not cause any effect. So therefore it's tissue specific. This means it is safer. We look at our first 120 patients that we did recently over the last 1 year. We found that 96% of patients no longer have AF. This is fantastic results because traditionally it's been about 85 to 90% for patients with the procedure achieving long-term success, but now we've achieved beyond 90%, and more importantly, it is safe. So the PFA is something that not only me, but every electrophysiologist in the world has converted, and we have changed to this new energy source because it's much safer and is more effective. So as a citizen of Malaysia, how can we avoid having atrial fibrillation? Studies have shown that when you reach 75 years and above, there's a 10 to 12% chance you will get AF, no matter what you do. Aging alone is a problem. What about younger patients? Well, we can help ourselves by number one, leading a good, healthy life. The same advice for patients not to get hypertension, not to get diabetes, not to get heart attack. Healthy living, good diet, don't smoke, and in atrial fibrillation particularly, no alcohol. And studies in Australia have shown if you have AF or you want to prevent AF, then you have to limit your alcohol intake to, the best is no alcohol, but if you have to drink, limit yourself to only 1 or 2 standard drinks per week, not per day.